Good morning. We will now explain the solution that the Laboratori de Referència de Catalunya, the Hospital del Mar, and the Consorci de Salut i Social de Catalunya offer for the RaDAR project. The Laboratori de Referència de Catalunya was created in 1992 through an agreement between the Hospital del Mar and the Consorci de Salut i Social de Catalunya. Subsequently, in 2022, the Biomedical Diagnosis and Imaging Network, called Laboratori de Referència de Catalunya, DIBI, was set up. This laboratory was created with the aim of integrating the four main areas of laboratory diagnosis: clinical analysis, diagnostic imaging, nuclear medicine, and pathological anatomy. This network serves 12 hospitals in Catalonia, covering 7 of the 10 health areas in this region. In 2023, a total of 17 million analytical determinations were performed, which means around 50,000 analyses per day. These figures give an idea of the size of the laboratory. The RaDAR is an European project that aims to respond to the urgent need to implement rapid detection methods for multi-resistant microorganisms and to improve antibiotic resistant management and control procedures through the implementation of cross-border collaborative purchasing of innovative value-based solutions. The Laboratori de Referència de Catalunya, together with the Hospital del Mar and the Consorci de Salut i Social de Catalunya, have proceeded to tender for the products and equipment needed to implement our innovative project. Our solution aims to reduce the number of hospital-acquired infections caused by antibiotic multi-resistant microorganisms. To this end, we have designed a proposal that includes the simultaneous implementation of 2 complementary and synergistic actions that will reduce the transmission of multi-resistant bacteria and therefore reduce the rate of hospital infection by these microorganisms. This strategy encompasses actions limited to the microbiology laboratory and others that affect the hospital clinical setting. The first action involves the use of an innovative screening system that will enable the rapid detection of multi-resistant bacteria that colonize patients admitted into hospital units, especially high-risk units such as intensive care, nephrology, oncology, and hematology. The second action consists of the prospective sequencing of the complete genome of multi-resistant bacteria isolated in the microbiology laboratory. This will make it possible to find similar relationships between them and be able to act quickly when it's suspected that a bacterium has been transmitted from one patient to another, thus cutting off these chains of transmission and preventing hospital outbreaks of infection by multi-drug-resistant bacteria. These 2 actions are limited to the scope of the microbiology laboratory, but must necessarily be coordinated with others related to the clinical hospital setting, in this case, at the Hospital del Mar.
The Hospital del Mar of Barcelona is a comprehensive service organization covering all levels of healthcare, with important provisions for research and documentation. The Hospital del Mar at Barcelona is the main healthcare facility of the institution, with a complete range of healthcare services and tertiary activities. The hospital provides healthcare services to a population of 315,000 inhabitants in the maritime districts of Barcelona and has 461 acute beds. In 2023, a total of 32,900 acute discharges and 17,000 interventions and 140,000 emergencies were attended in our hospital. As we saw earlier, the 2 actions explained above fall within the scope of the microbiology laboratory. The results obtained must be efficiently communicated to the Hospital del Mar and to the Hospital del Mar Infection Control Reference, so that necessary measures can be taken to prevent the transmission of the multi-drug resistant bacteria and therefore reduce the number of cases of hospital infections caused by these microorganisms. The implementation of a rapid screening method for the detection of multi-drug resistant bacteria will allow patient isolation measures and the activation of contact precautions, as well as the tracking and evaluation of exposure risks and taking general preventive measures to avoid the transmission of these bacteria. On the other hand, the information provided from the prospective sequencing of the complete genome of multidrug-resistant bacteria will allow us to carry out prospective epidemiology by identifying the possible sources of transmission as patients, healthcare personnel, objects, environment, and so on. Therefore, this facilitates the rapid implementation of the corresponding control measures aimed at avoiding the transmission of multidrug resistance between patients and thus preventing the establishment of outbreaks at hospital by this type of bacteria. Therefore, the simultaneous implementation of innovative technologies for the rapid detection and prospective whole genome analysis of multidrug-resistant bacteria can be a paradigm shift and a transformative solution for hospital care, offering improvements in patient outcomes, infection control and resource management. Thank you very much.